Hey, how's everyone doing? It's Isaac Wade, Dr. Pharmacy, and in this video, we'll be breaking down natural health products and supplements for treating male pattern hair loss. Specifically, we'll be discussing which supplements might actually be worth your money and which ones are complete snake oil. But first of all, let's review our understanding of male pattern hair loss. This is a natural thinning and recession of the hairline experienced by most men before the age of 35. Unfortunately, male pattern hair loss is a condition that's progressive and can only be corrected through surgical and pharmacologic interventions, at least most of the time. The most common of which include drugs like finasteride, dutasteride, and minoxidil, or hair transplant surgery. However, many consider these treatments to be too expensive, invasive, and would prefer a more natural alternative. Now, as a pharmacist and someone who's been taking finasteride and applying minoxidil for more than 5 years, I'm obviously in favor of approved pharmaceuticals, as they tend to have great quality control so you know exactly what you're getting, and good evidence with support for many large double-blind randomized placebo-controlled trials. However, not everyone can tolerate these drugs. They're not always the most affordable or accessible, and for that reason I can understand why people might be into natural health products. Thankfully, there is actually some evidence for natural health products which I want to summarize in this video, so if you're someone who's considering using a natural alternative for treating their hair loss, make sure to watch this video so that you can choose a treatment that's supported by actual science so that you can keep your hair and maybe even regrow some in the process. So first of all the information for this video comes from a paper by Hosking and colleagues, which provides a complete summary for the evidence for natural health products for treating male pattern hair loss and other hair loss conditions. Specifically, the paper talks about the use of amino acids, caffeine, capsaicin, curcumin, garlic gel, marine proteins, melatonin, onion juice, procyanidin, pumpkin seed oil, rosemary oil, saw palmetto, vitamin B7, also known as biotin, vitamin D, vitamin E, and zinc. And wow, that is a mouthful. So let's get right into it. First of all, let's talk about amino acids, and there are some small randomized control trials and cohort studies discussing the use of oral L-cysteine as well as oral L-lysine. However, these amino acids were combined with a number of other ingredients such as retinol, histidine, copper, zinc, manganese, and selenium, and as many others as well. And although the studies did show some efficacy, the authors concluded that we can't be certain if these amino acids were effective since none of them were studied in isolation. Caffeine is next, and it's most known for its stimulatory effects when taken orally in coffee or energy drinks. Now, topical caffeine has been studied for treating male pattern hair loss in several randomized controlled trials, and here, caffeine has been shown to reduce hair loss in the hair pull test and to deliver similar results to topical minoxidil 5% in terms of increasing the number of hairs in the anagen growth phase. One randomized controlled trial of 60 patients with male pattern hair loss found that topical caffeine with topical minoxidil was more effective than minoxidil on its own for improving patient satisfaction, and another RCT of 71 patients with male pattern hair loss found that a topical formulation containing caffeine 1%, minoxidil 5%, and azelaic acid 1.5% to be more effective than minoxidil on its own when it was evaluated by dermatologists as well as patient self-assessments. However, the authors noted that while topical caffeine has potential for treating male pattern hair loss, more studies are needed, particularly studies with better efficacy measures such as hair counts and shaft diameter rather than patient satisfaction and anagen growth phase ratios. Next off, let's talk about capsaicin, which is the active ingredient in chili peppers and gives it its spiciness. Now, one cohort study of 48 patients with a mix of hair loss conditions found that oral capsaicin with oral isoflavone was better than placebo for improving hair growth. There were also a number of other studies on topical capsaicin as well. However, the results were mixed and only men with alopecia areata were studied. Given that we're most interested in men with male pattern hair loss, not alopecia areata, I wouldn't waste too much time with capsaicin until more studies are done, since only one's been done so far. Curcumin is the next ingredient I want to talk about, and this is the active ingredient in turmeric, which has been used as an anti-inflammatory supplement for centuries. One randomized controlled trial of 87 participants with androgenic alopecia, which is another way of saying male pattern hair loss, had a topical 5% curcumin extract compared with topical 5% minoxidil. And while researchers didn't find any improvements in hair counts, when they took a look at photographic assessments, that is where they found that curcumin combined with minoxidil did yield some notable improvements, suggesting a synergistic effect between minoxidil and curcumin. However, this is just one study and more are needed to confirm whether or not curcumin is effective for treating male pattern hair loss. Garlic gel is the next ingredient I want to talk about, and there was one randomized control trial done in patients with alopecia areata taking a look at garlic gel. However, we're interested in male pattern hair loss. We're not interested in alopecia areata, so I'm going to skip over this completely. The next supplement I want to talk about are marine proteins, which actually seem like the most promising supplement so far. And the product I want to talk about is called viviscal. And viviscal has a pretty impressive resume of cohort studies in randomized control trials supporting its efficacy in male and female pattern hair loss. One notable study was a randomized control trial of 60 patients with male pattern hair loss where viviscal yielded an increase in total hair count, terminal hair density, and total hair density after 6 months of therapy. The product also appears to be well tolerated except for people with shellfish allergies where it could cause an allergic reaction. Now, this is the first product that the authors as well as myself would consider to be a safe and effective treatment for male and female pattern hair loss, given the sheer volume of high-quality randomized control trials. Next of all, let's talk about melatonin, which is the neurohormone produced by the pineal gland which helps regulate sleep. Now, there is some evidence for topical melatonin in male pattern hair loss. A randomized control trial of 40 patients treated with a topical melatonin solution saw an increase in hairs in the anagen growth phase, and several cohort studies with a melatonin 0.0033% solution demonstrated an increase in hair counts and a reduction in hair loss, including a study with over 1,000 participants. Now, the authors didn't comment on whether or not they considered topical melatonin to be an effective treatment, but in my opinion, given the evidence, if one had access to the solution used in the trials, it could be a powerful add-on therapy that might be worth pursuing. Onion juice is the next ingredient that I want to talk about, and onion juice was studied for treating alopecia areata in a randomized control trial of 62 patients. However, we care about male pattern hair loss. We don't care that much about alopecia areata, so I'm going to skip over this study as well. Precinitis are the next ingredient, and these are a class of flavonoids found in plants. Topical precinitis derived from apple juice were found to increase hair counts in 3 separate randomized controlled trials of patients with male pattern hair loss. Oral precinitis were also studied with or without the addition of other supplements in a randomized controlled trial with 250 participants, and were found to improve hair counts and hair weight. Now, I'm not sure if procyanidin hair supplements are available commercially, but they do seem to be supported by some serious evidence, and it could be worth getting into if you can get your hands on it. Oral pumpkin seed oil is next, and oral pumpkin seed oil was studied in a randomized controlled trial of 87 patients with male pattern hair loss, and it was found to increase hair counts after 24 weeks of therapy, as well as improve patient satisfaction. However, the product that was studied was actually a Korean supplement called Octa Sable Plus, which didn't only contain pumpkin seed oil, but also contained ingredients derived from vegetables, primrose, red clover, and tomatoes, which makes it unclear if the hair benefits were from the pumpkin seed oil or from any number of other ingredients. And because there aren't any other studies evaluating the effects of pumpkin seed oil, I wouldn't be able to recommend it for most people, unless you can get your hands on the original Korean supplement. Topical rosemary oil is next, and topical rosemary oil was found to be non-inferior to minoxidil 2% at improving hair counts in a randomized controlled trial with 100 participants with male pattern hair loss. And while these results are exciting and the study seems to be well designed, we need to remember that this is only one study, so more studies are needed to confirm the efficacy of this molecule. Saw palmetto extract is the next ingredient I want to talk about, and this extract is from the berries of the saw palmetto palm tree. Now, saw palmetto has an interesting mechanism of action, particularly in the way that it blocks the action of DHT. Like dutasteride, saw palmetto blocks both types of 5-alpha reductase, preventing the conversion of testosterone to dihydrotestosterone. Saw palmetto also blocks uptake of DHT into the nucleus of target cells, and it blocks binding of DHT to androgen receptors by 50%, and it also increases the activity of the enzyme 3-alpha hydroxysteroid dehydrogenase, which is responsible for catalyzing the conversion of DHT to its weaker metabolite androstenediol. Now, oral saw Palmetto 200 milligrams was studied with 50 milligrams of oral beta-cystosterol, and it was demonstrated to be superior to placebo in a randomized control trial of 26 patients with male pattern hair loss. In another randomized control trial of 100 patients with male pattern hair loss, saw Palmetto was compared to finasteride, and they saw that 38% of men treated with saw Palmetto experienced hair growth versus 68% of men treated with finasteride. Topical saw Palmetto was also shown to increase hair counts in a cohort study. Now, the authors found that saw Palmetto, although inferior to conventional therapies, was likely to be clinically effective and was a viable alternative for men looking for a more natural treatment for their hair loss. Next, let's talk about biotin, which is also known as vitamin B7. This is a B-complex vitamin, and it's a cofactor for the carboxylase enzymes involved in fatty acid synthesis and a number of other processes. Now, despite the popularity of biotin in the hair loss community, the authors found practically zero evidence for biotin in the treatment of male pattern hair loss, including 0 randomized controlled trials. The authors wrote that the only time where biotin supplements make sense is when the patient is biotin deficient, either due to medications such as antiepileptics or Accutane, or due to inherited biotin deficiencies. Otherwise, taking biotin is probably a waste of your money and might also mess with your thyroid labs at your next visit to your GP. Topical vitamin D is the next ingredient I want to talk about, and topical vitamin D has only been studied for treating alopecia areata, so we're not going to talk about that either since we care about male pattern hair loss. Vitamin E is next, and topical vitamin E was studied for treating general hair loss in one randomized control trial of 38 patients, where hair counts were increased by 34.5%. However, this is one study and the causes of hair loss were not clearly defined, so I would say more research is needed to confirm whether or not vitamin E is effective. Zinc is the next ingredient I want to talk about, and zinc shampoo 1%, which is by the way the same ingredient found in men's Head and Shoulders shampoo, was compared with minoxidil 5% in a randomized control trial of 200 patients with male pattern hair loss. All treatment groups had an increase in hair counts, however the zinc group had less than half the increase as seen in the minoxidil group. And combining minoxidil with zinc didn't seem to be any better than using minoxidil on its own. In another study, oral zinc sulfate 50 milligrams with calcium pantothenate 100 milligrams was compared to minoxidil 2% in a randomized control trial of 73 patients, I believe all women, with androgenic alopecia. Now, all treatment groups had positive results, however, minoxidil produced a greater increase in hair counts, whereas oral zinc produced a greater increase in shaft diameter. Now, the authors suggest that zinc may be a good add-on treatment for patients experiencing hair loss, as it is widely available and quite safe. Now that we've reached the end of our list, if I had to recommend a natural health product for male pattern hair loss, I would say viviscal is the clear winner. It's supported by so many randomized control trials. It appears to be very safe, with the exception of people with shellfish allergies, and the authors of the paper also seem to feel the same. The next ingredient I would recommend would be saw Palmetto, which has a mechanism of action that makes sense in that it blocks the activity of dihydrotestosterone. And although saw Palmetto is not as good as finasteride or dutasteride, it does seem to be okay for treating male pattern hair loss, and the authors of the paper generally also seem to agree. Then in no particular order, supplements that I would consider worth trying for people that had to use a natural product would include procyanidins, topical melatonin, topical caffeine, zinc, and topical rosemary oil. Anyways, that's all I wanted to talk to you about today. I hope you found this video informative. I hope you found it interesting. I hope you learned something new. And as always, I'll see you in the next one.